I get asked a lot to send a outline for the course for the RMT Pro facial massage and skincare course, and I decided to do a video on it because I like doing videos. So what can you expect over the 3 days for the RMT Pro facial massage and skincare course? The 3 days are set up so that generally in the morning we're going to be going through theory, and in the afternoon is going to be practical application. So in the morning, the very first day, the very first lecture I give is about scope of practice. A lot of people don't understand the difference between facial massage and a facial, and what RMTs do and what estheticians do. So when I developed the course, I developed it with the scope of practice of all massage therapists in Canada in mind, and not just in mind. I actually have everyone's scope of practice printed out, and I teach specific to the province and to the people who are in the class. And so generally, I've taught a lot out in Saskatchewan and Alberta, and so I'll go through the scope of practice for BC because I get a lot of BC therapists fly to Calgary or to Edmonton for my classes. I go through all of the associations that are applicable in Alberta, and I go through all of the associations and the College of Massage for Saskatchewan when I'm out west. When I'm in Ontario, I'll be right now in Ontario, I'm going to be doing an overview of the Massage Therapy, Registered Massage Therapist Association of Ontario, as well as the College of Massage Therapists of Ontario, guidelines that they have, as well as probably the Manitoba associations, all the associations that are applicable there, because I will have some Manitoba students flying out as well. And then if any other province is represented, we go through that as well. So that's the very first lecture, because a lot of therapists don't actually understand what the difference is between an esthetician and an RMT doing massage therapy. And let's face it, only massage therapists can do massage therapy, registered massage therapy. And that's what we're doing, and that's what we're learning. And so I get into detail about that and what the scope is and what it's not. And that's really addressed on the first day because a lot of people have so many questions about that, which is totally natural and normal. So we get into very detail and in-depth in scope of practice. It takes quite a bit of time. And so other lectures that you can expect during the course, of course, we're going to address anatomy, physiology, we're going to address pathologies, we spend quite a bit of a time on assessment as well. So we address all those things as per usual, just like a normal registered massage therapy class, because that's what we're learning, registered massage therapy. And so one thing that I do like to make clear is that just like if you were massaging the leg and you were taking a class to massage the leg, everything you massage on the leg is going to affect the knee. And that doesn't mean that you need to hyper focus your practice on the knee. You might choose to. You might choose to hyper focus your practice on the knee after you learn to massage the leg. But just like that, some people will choose to hyper focus their practice on TMJ. This is not a hyper focused course on TMJ, although everything that you learn to massage on the face is going to affect the TM joint, right? That's what it is. And so you're allowed to learn how to massage the face without necessarily focusing your practice specifically on one joint, just like you would do that in the leg. So just because you aren't hyper focused and that's not your area to specifically always zone into, you're learning about the full face, not just the joint. So that's something that I cover fully within the course as well. If you want to hyper focus your practice on just the TM joint later on, go right ahead. But this addresses the full face, and it does get into how the full face affects the TM joint. But just like you can learn how to massage the leg and not necessarily hyper-focus your practice on the knee, you can also do that applicable as an analogy to the face and the TM joint, right? So we do the whole face. We do the neck, and we do the top of the chest, or as some refer to it, the décolleté. And yes, that's actually a very appropriate word to use. And also, I do teach quite a bit of buccal massage. Now, some people don't like the word buccal, and that's fine. It is just a Latin term meaning regarding the cheek. And I teach you buccal massage within our scope of practice, which is just, it's lovely. It's great. Very effective for a lot of different things. So other practical things that I teach, we deal a lot with scar tissue, and with when someone comes in and there's been a medical procedure on their face. So no matter the reason for the medical procedure, it might have been a procedure that, let's say if there was a neuromodulator put in, or if there were something like threads put in the face or fillers. I teach you how to deal with those medical procedures when you're doing facial massage, and contraindications, or how to massage, what's appropriate and not appropriate when there's been medical procedures to the face, and also scar tissue, things like that as well. We get into that quite a bit. So you'll be able to do quite a bit of aftercare for people who have had medical procedures to the face. And of course, during pathology, we address all of those things. The first day, I teach you basic massage to the face. And then the second and third day are the more detailed, intricate techniques to deal with things like scar tissue to the face. So that's kind of how it's set up on a practical basis. The first day you're getting into it, you're learning like how to apply effleurage, pedressage, and all those things to the face. And then the second day is more, I don't know that you'd call them advanced techniques, but techniques specific to certain situations that come up on the face, like when there's been medical procedures, things like that. I do get into, because a lot of people will have an adjacent retail business with massage therapy, whether they're doing facial massage or not. So I get into the guidelines that are given out by the associations for when you are doing retail in your business, or when you have an adjacent retail business. Now that's because a lot of spas, a lot of clinics also have an adjacent retail business. And so we talk about all the guidelines from province to province, and recommendations for how to separate that out, because it is something that comes up. So it's good to talk about it, because these are things that people do within their business as well. One thing that you might have noticed if you've been watching any of my posts or advertisements, that kind of thing, is that a lot of people hate on facial massage because they really don't understand their scope of practice, and they really don't understand what aesthetics is, and all they can see is massage therapy being applicable aesthetically. And so I think you might have guessed by now that I think that's wrong. And I get into that within the very first lecture, scope of practice, but also to when you start massaging the face, you will get a lot of blowback from other massage therapists who don't understand their scope of practice, or who believe that massage therapy is really only what they believe it is, and they really don't understand their scope of practice, or scope of practices in other provinces, or how it's applicable in their provinces. And so I do go into, I have a whole lecture called When RMTs Attack, how to deal with RMTs who are really being disrespectful, inappropriate, And there's kind of a few different ways to go about that. And you can kind of make your choice based on your own personality, how you want to deal with it. But I do teach you how to deal with people who give you a lot of blowback about facial massage, and which is totally inappropriate because it's completely within our scope of practice. I teach you how to advertise within our scope of practice, what's appropriate, what's not. And also too, I do teach about the massage mediums that I use and that you can use on your patients as well. So I'm not a wholesaler. This is all on my website too, on my frequently asked questions, but I'm not a wholesaler or a distributor. I'm not part of any MLMs. I do have a retail business for my patients and for people who just want to walk off the street and purchase things. And so I love certain products, but you might not love certain products. And so when I teach about massage mediums to use on the face, let's face it, a lot of people are picky about what is used on the face. A lot of your patients will be picky, and rightfully so, because they might be a little bit more prone to pathologies and things like that that pop up on the face, that happen on the face, that don't happen on the rest of the body very often, or don't concern them on the body. So there's a lot of concern around the ingredients that you are using on the face. So when I teach about products, I will use the products that I know well as examples, but I'm not trying to sell you the product, okay? That's completely not what I'm trying to do. I teach about ingredients in products, so you can go and look at whatever product is out there that you want to look at, and you will know what the ingredients in the massage medium does. And I actually think that even applying massage mediums to the body, if you don't know what is in there and the effect that it may or may not have on the body, I think that's irresponsible. Also, too, I believe highly in sanitization, and I believe that even when we're massaging the rest of the body, not the face, the massage therapist overlooks sanitization quite a bit. And so there are products that are good for sanitization and made for sanitization of the body before massage therapy is applied. And I think sanitization is something, preparing the tissue and making sure it's sanitary, that's actually an ethical responsibility of ours. And so I teach about that too. Let me think. There's so many lectures we could get into, but that's kind of the basic overview outline of the whole course. And you are required to participate in the course. So you do have to be able to receive and give facial massage. I have had people who haven't participated, or who have who have tried not to participate to get facial massage. And sorry, you do have to participate to complete the course. That's definitely something that needs to go on. And then as well, just making sure that we get a lot of experience on each other, that we can use our palpation skills, that we know what the treatment feels like on ourselves, and we know the effects. And I do like to give people lots of different options and opportunities to feel, let's all work on each other and feel the different structures of the face, get in there, see what the techniques do from different face to different face, right? You can make this as luxe or as, let's say, clinical or clinically luxe of a treatment as you want, just like you can with regular massage therapy. It can be in a beautiful space with beautiful scents in the room, with hydrotherapy, with all those things that are completely fine to do with regular massage therapy. You can do it with facial massage, or you can keep it very basic. You might choose to use a lot of different massage mediums, or you might choose just to use one. And it's the effect of the massage that we're going for here. And so you'll be able to learn how to tailor massage therapy to the face to go the direction that you want to go within your scope in your own practice. And that's an awesome thing. So you might be someone who wants to work in a very bare clinical space that you like, not a lot of, let's say, spa-like value or aesthetic value to your room, and that's fine. Or you could have a very, very luxurious style place that, and you want a treatment that feels like it matches that. So you can go that way as well. Either way is fine, and you're allowed to work in the scope of practice for both situations or meet somewhere in between. So we can tailor it to that as well. If you have any more questions or you feel like I didn't address anything with this kind of video outline of what we're learning, just shoot me a text, 306-321-4991. That's my clinic number here in Saskatchewan, and I just have a confidential clinic number that also receives texts, and you can shoot me a text or you can email me, get a hold of me on social media for any other questions about the outline of the course that you have. Thank you for watching the video, and thank you for your time. Hope to see you at the RMT Pro Facial Massage and Skincare course.